Dr. Jonathan Tripp joins us in studio this morning. We're going to be talking a little, some history, is what he mentioned, I think, in an email message he sent me. A brief history lesson, which I enjoy history. First of all, welcome.
Thank you.
Uh, Talking a little bit about osteopathy today.
Yeah, osteopathy or osteopathic medicine is a branch of medicine that is one of two that in the United States is recognized as full-fledged physicians and surgeons. The one most commonly we think of MDs, and an osteopath is known as a DO. If we go back in history, an MD truly is what's called an allopathic physician, and the DO is the osteopathic physician. So a lot of people don't have a clue what that name infers, but what it means actually is bone doctor. So, in order to get you back to, well, what does a bone doctor do, and how come they're a full physician and surgeon? Let me give you a quick lesson. Back in the 1880s, we have a doctor by the name of A.T. Still. He was an MD, and he was a doctor through the Civil War. So he had some very serious and good experience as a doctor from that era. And he lost all of his family to an influenza epidemic in the 1880s, and so became very disgruntled with medicine in general because he had no way to save them or protect them with the techniques that he had at the time. In fact, he completely turned away from medicine even later on after developing what is now known as osteopathy or osteopathic medicine, because the medicines at the time were completely based on, they were compounded, which we love compounding pharmacy, so I don't want to let any negative vibe come out of that. But, they truly use the, what is it called, mortar and pestle. They're mixing everything to be taken, but the base material that they used were primarily poisons like arsenic and cyanide. So imagine that and his experience with not being able to save his family. He was looking for an alternative, and after probably a pretty significant period of depression, came upon what were called bone setters, and these were European tradition people that we would think of as chiropractors today. So he took hold of that and developed it further and came up with some things that were very important. One of his tenets was the rule of the artery is supreme, and as I go through my medical training, more and more that is true. Where there is good circulation, there is good organ function, good muscle function, good structural function, and you actually think better. So, he was a pretty smart guy for his time, probably for our time. And so, with all that together, he opened a school in this little town called Kirksville, Missouri. I think it was in 1892, and that is the school that I actually attended. So that's why I know the history lesson. And it is the traditional, it is kind of the mecca for osteopathic physicians. I didn't really realize how prestigious of a school it was until I was about in my second year and visited with other students from other schools, and you would have thought I was at Harvard. So it's a very good training. But the tenets of osteopathy, two of the basic ones, is the body as a unit, not just systems, which is primarily the learning of the MDs, and that structure and function are interrelated.
We call that holistic today, right?
Oh, well, we're going to get down to that. That's exactly that's where we're going with this, is because you're really looking at the whole body, and even beyond that. In osteopathy, we talk about mind, body, and spirit connection. And so I wanted to give some examples of those connections, and I'm going to welcome calls. I even had a person in my office yesterday that said as they're driving to Boise, they may call and give me some harassment in the form of a question. So I'll look for that too. But welcome questions on this, because there's a lot of things that I just really want to put out there, that we have a lot of DOs in town. St. Luke's has become they've become a favorite recruiter of DOs, and
You were working with one in an emergency a few weeks ago, in fact, right?
another DO with me. Yeah, I guess I honestly don't know whether he is or not. But that's true. We had an experience at Gold's Gym. Is that the one you're talking about? Yeah, we had a gentleman who basically went down in full cardiac arrest, and another physician and I were called to that room, and
When you say you have a number of them, is that just because of the how that branch of medicine has grown?
Well, it has represented about 5% of the total doctors, and it's probably a little higher now, but probably no more than about 7% of total doctors.
So very much a specialty still.
Well, it's really not. They are the generalists. In fact, that's part of the preaching, and I call it the preaching in school, is that you are a generalist first and later become a specialist. Where in MD programs, very early on, you're focused on what's your specialty going to be and kind of ignore a lot of the
Ah,
rest.
okay, sure.
And, so it is true that not all osteopathic physicians do a lot of the hands on, but let me teach a little bit about that. They are like, um, let's say, very evidence-based medicine is probably the first thing I should say. So very much like our Western medicine MD training, that we are looking at studies, we are looking at where the proof is. Are we doing what's best, or are we simply following tradition and maybe not doing the best that we can? So evidence-based medicine, and that way we're like an MD. Hands-on medicine, or what's called manual medicine in the MD world, where we're touching and checking things out and actually fixing things. So that's very similar to being like a physical therapist or a chiropractor. And then on top of that, there's a big focus on nutrition and exercise and even an openness in our training to what is often termed complementary medicine, like herbal medicine. So it's not that we live in the complementary world, but at the same time, we're open to that. And as a result, I learn a lot from patients, and a lot of the attitude that I personally take is if it will not harm you, then it's okay trying. The problem is you don't always know what will harm you, and the other part is there a lot of people get lost in this statement that if it's natural, it's safe. Well, arsenic and cyanide are natural; they're not safe. So you can't just say, well, gee, I'll give you an example: licorice root. Licorice root is great for some things, but it also promotes hypertension. So you can't just say it's natural, therefore it's okay. You have to actually know what you're dealing with, and a lot of people have gone off of somebody else's opinion, and so we're looking for evidence, but also, I'll give you another example where I use that, and that is somebody who has liver disease. If they have fatty liver disease, high liver enzymes, milk thistle is one of the best treatments for that. So, that would surprise a lot of people that a doctor would actually admit that a herb could do some good. So that's an example of how osteopaths can be a lot like what most people know as a naturopath. So what I say, the osteopathic difference is more tools are better. And so, if you're a specialist, you tend to focus on the things that you do all the time and kind of forget or ignore some of the rest. If you are somebody who doesn't have the right to write prescriptions, prescriptions become out of sight, out of mind, and sometimes even viewed as evil. And so there's kind of a skewed point of view there, in my opinion. If you're someone who has only access to hands-on, you do great things with hands-on or manual medicine. But if that's the only tool you have, you're missing some of the other possibilities with medications and even surgical intervention. So, I'm not the surgeon. We do a lot of skin surgeries, but I wouldn't be your doctor taking out your gallbladder, although that was part of my original training. I'm going to ask a surgeon to do that, but I know of those things. I've been involved in those things. So it's a broader training. My wife even says, the MDs get the summers off when they go through med school. The DOs don't because we're actually in school learning more. So there's a lot of fun. And this, it sounds like I'm bragging, but it just is more tools are better. When you come in with a headache, anybody that has a bad headache will say, I have a migraine. That's just, the terminology.
But it's not necessarily
Yeah,
migraine.
yeah, true migraine usually has some specific factors in it. You're seeing flashing lights, you have a specific smell, what they call an aura that happens usually before the headache hits. That's called the classic migraine. Now there are a variety of types, and that is a whole different discussion. But sometimes we have headaches because we need glasses. We have vision problems. But more commonly than not, when somebody comes in and tells me they have a migraine, because of my hands-on skill, I can actually touch, feel, check the base of their skull, their neck, their shoulders, and then and ask specific questions about how the headache developed, where they feel it, and often can turn right back to saying, "Oh, I think this is real more tension related than not." And then we get to why is there tension? Did you do a physical strain? Are you emotionally, upset? Or, is there extra stress in your life in the last week or two? And if you don't usually get headaches, we're really looking for what's the proximate cause? What really got this going? It's not just simply, oh, it's a headache. And yes, often aspirin or Advil or Tylenol, will take care of it. And that's beautiful. Why not do a simple answer short term? But if you have, a headache every day for a week and you've never had headaches in your life, something new is going on. So we're looking for everything from, you know, is your daughter getting married in 2 months, like mine announced to me 2 days ago? Or is there, and I laugh about that, but, that's going to be stress for the next couple of months.
I can imagine.
So am I going to have headaches? I don't know, but my wife for sure is. So is there that, or is there something as scary as there's a tumor? Do you have a brain tumor because you've never had this before and now they're showing up? So, you know, having those different skills, and especially if I can work on their neck and their shoulders and reduce that headache by half or make it go away altogether in about 5 minutes, that's very reassuring that it's not a tumor.
Want to mention it's 8:52. Dr. Jonathan Tripp in studio with us from Tripp Family Medicine. It's called Better Health with Tripp Family Medicine. Remember, life's too short not to feel good. We're at 59 Bill Colley as well on KLIX. And for people who'd like to reach the office too, how do they go about doing that?
Yeah. Let me actually promote a little bit right now. July
Big event.
14th. Yeah, we got a big event. We have not done any grand opening, anniversary, anything since we opened 5 years ago. And we're going to have a fifth anniversary pool party at the city pool. So come celebrate with us. We are allowed only 600 people. We're from 5 to 7 p.m. on July 14th. So we're talking a month from today. Um,
Bastille Day.
yeah, there you go. And today, by the way, did you talk about it's the president's birthday? Yeah.
Flag Day too.
Okay, there you go. So 5 to 7 p.m., July 14th, limited to 600. So you have to RSVP and you have to be a patient or the immediate family, meaning if you're the mom or dad, can bring your kids. You don't get to bring grandparents because you don't get the aunts and uncles because we're limited. We got way more than 600 patients, so we need to RSVP. If you're not a patient, you got a month. But I'd say do it this week because this is going to be a blast. We're going to have food and games, and it'll be a good time, and it'll be quick 2 hours. But those are the 2 hours that we have at the pool, so we'll be in, and then and those that want to stay later can pay to stay for free for the open swim after. So I found that out yesterday. But so how to reach us? Telephone number 208 933 4400, 208 933 4400. And let's see, website is trippfamilymedicine.com and Facebook at Tripp Family Medicine. So love to hear from you. We're going to have a blast on July 14th.
Got about 3 minutes. You also have a listing here on irritable bowel syndrome, which I understand afflicts mostly, but not always, but mostly women.
It is a majority of women, but I definitely see it, men and women, pretty heavily. And I will say that I'm not a gastroenterologist, so that'd be a specialist in, stomach and intestines. But more often than not, when I have somebody that has irritable bowel symptoms like diarrhea, constipation, and it goes back and forth, I just had a lady yesterday, you'd think I changed her life. She's had this for years. And I talked her into, because my connection with that is this is more stress than it is your stomach. And so if we really identify and go after the stress and treat that stress, whether it's with complementary medicine type techniques that have a little weaker effect or traditional medicine. My favorite in this case is Lexapro. Within about 3 weeks to a month, the symptoms either are very much better or disappear. And it was just a fun visit with her yesterday because all she was doing is beaming and saying, it's just it's gone. It's totally gone. I don't have to worry about where the nearest bathroom is everywhere I go now. So that is a mind body or spirit body connection that is just kind of a natural for an osteopath to look for. But we got lots of others we could talk about: athletic injuries, chest pain. Is this my heart or is this just a rib that's kind of out? Those are
And I had
those are
that issue a
things.
few years ago. I thought I was having some issues because I felt a pain in my shoulder. left side, and it turned out to be the way my mattress, my old mattress, I was told replace it, and I did, and my shoulder pain went away. But I was concerned that I was having a heart issue.
Yeah, and I don't want to downplay the heart issues because often I'm trying to fix the rib, the shoulder, whatever else because I can. And if that doesn't work, we're moving right on to evaluating your heart in a very serious way. So, the bottom line of this is you're combining evidence-based medicine with hands-on medicine and with nutrition and exercise and even inclusion of some complementary medicine. That's holistic medicine. That is the osteopathic difference, and my statement is more tools are better, and that's better health.
Better Health with Tripp Family Medicine, we should point out. By the way, I did get a note back from your office last week. Everybody decided to check out The Prisoner, the TV show The Prisoner, after my reference to the big red ball being like the big white ball from the TV show. But will you have the ball out at the pool party?
Absolutely. This is the biggest beach ball I know of. It will it's a lot of fun. It's an 11-foot diameter ball. It makes a 6-foot man look small. It is fun.
But still floats in a pool.
I'm sure we'll probably figure out how to play volleyball or I don't think you can do water polo with this one, but
One more time for people who'd like to get in touch with your office, how do they do it?
yeah, it's area code 208-933-4400. So that's 933-4400. We're taking new patients and new pool party members. So give us a call. We'll get you in.
Wanted to thank Dr. Tripp for dropping by today, and we're trying to hook up in a few minutes. Don't know if we can do it today, but we've been trying to work this out this morning with Representative Raul Labrador, who knows some of the people who were involved this morning in the shooting at the baseball practice in advance of the congressional baseball game. We've got more details on all of that coming up too, as well after news from Fox at 9 o'clock this morning on Top Story.